My name is Sam Olson. That's the name you see here on the logo.
That's a great
And
logo.
thank you, thank you. Um, and I am an independent insurance broker that specializes in Medicare. And so I just do 100% Medicare insurance and help folks kind of navigate through this confusing process. The federal government has done us zero favors in trying to understand this. It ends up just getting more confusing as the years go on. So I'm going to try my best to make it as palatable as possible and easy to understand. I want to point out that this is an educational Medicare seminar, which simply means there will not be a sales pitch of any kind. I won't be requesting your information, but like I said in the beginning, you can reach out to me if you wish on your own volition, okay? And if you have any questions along the way, feel free to interrupt me since we have a pretty small group, okay? So the first thing I like to do is review the different parts of Medicare. We've got 4 parts to Medicare. Depending on the path that you chose or you will choose, or maybe you've changed in the middle, you will have some of the parts, but not all of the parts, okay? And we'll discuss that here shortly. I'm also going to make you aware of some changes for Medicare in 2022. We've got 2 kind of ongoing changes that you should be aware of, and we'll discuss that. The other thing I'm going to point out is some Medicare scams and show you how to avoid them, show you how to spot them so you know when to avoid them. Along the way, I will sprinkle in some tips and tricks to just kind of help you or your residents, maximize your benefits a little bit better. So like I said, we've got 4 parts to Medicare: A, B, C, and D. And the first part is called Part A, hospital insurance. In my opinion, that is not a great term to describe what Part A is, because you could be in the hospital and not be covered by Part A, and you could be out of the hospital and be covered by Part A. So thank you, federal government, for making that confusing for us. Hopefully, I will be able to define this a little bit better for you. Now, it does cover most of your inpatient hospital care. That's the key word, inpatient. And to be more precise, we should say you are formally admitted as an inpatient, okay? Because sometimes you could be in the hospital staying the night, you could be there 2 or 3 nights, but you're just there under observation. Being there under observation does not mean you are an inpatient. That means you're outpatient and you are charged differently. You would be charged under Part B instead of Part A. So it's very important to know, hey, am I here as an inpatient or an outpatient? Okay. It also covers skilled nursing facility. All right. The Part B Part A will cover the first 1 through 20 days. Beyond day 20, you have to pay a daily copay of $194.50 per day up until day 100. Now, if you have a supplement, most supplements cover the skilled nursing. If you have a Medicare Advantage plan, there is coverage, but it depends on the specific plan and how they cover it, okay? Inpatient medications. So if you're in the hospital and they're giving you medications while you're there, that does not go against your drug plan, that goes against Part A. Home health care. So see, we're at home, we're not in the hospital. So how is that covered? Well, as long as you're approved for home health care, you qualify for Part A. How do you qualify for home health care? Well, there's about 5 different criteria, but the main criteria is that you can't really do anything for yourself. You can't do daily activities for yourself uh, reasonably well. So, and then the doctor has to sign off on it, and then you have to use a Medicare approved home health care company, okay? Hospice care is one of the most generous benefits of Medicare. Feel rest assured that if you or you know someone, your spouse needs hospice care in the future, Medicare covers everything almost 100%. There's very few small exceptions, Like sometimes you might have a copay on a medication, or if you need to give your caregiver a break, then you would need to hire a caregiver to take that place. But other than that, um, Medicare covers hospice pretty much 100%. In fact, you really don't even need a supplement in that case. I still recommend having one, but if you're just using hospice care, that's all you need is Medicare. If you're given any blood in the hospital, that is Part A. So I prefer to think of Part A as all of your inpatient care as opposed to hospital insurance. Okay, this is stuff that usually takes a little bit of time. It's not done and over with in a day. Any questions about that? Okay. So tip number one, if you are an inpatient in the hospital and you feel the doctor is discharging you too soon, you have the right to what is known as a fast appeal. And this is an opportunity to see if you can get care for a longer period of time. And it's done by this third-party organization called the Beneficiary and Family-Centered Care Quality Improvement Organization. Okay, you don't need to remember that, but that's the acronym, that's what it stands for. And they are an unbiased third party. So they're not in favor of the hospital and they're not in favor of Medicare. They are looking at your health situation objectively, and they ask the question, does this person need to stay longer? If the answer is yes, of course you get to stay longer and continue to receive care. But even if your appeal has been denied, you can remain in the hospital until noon the next day following the decision. So they cannot discharge you until the appeal is done, which could take about a day, depending on when the third party comes to assess your situation. And once they decide, they cannot discharge you until the following day. So you're pretty much guaranteed at least an additional 24 hours in the hospital just by appealing the decision. And they will continue to give you care until you're discharged. Okay. Now, the question I always get is, how do I know, when I'm in the hospital to do this, who do I talk to? Well, in the stack of your discharge paperwork, when they hand it to you, you will see something that talks about this organization here, and the hospital staff can call them for you immediately, okay? So we talked about Part A, and that was all of your inpatient care. Now we're talking about Part B, and Part B is called medical insurance. Again, kind of vague. So what is Part B? Well, this covers things like doctor visits, lab work, x-rays, preventative services, which is a huge part of Part B now, because Medicare got smart and said, well, if we can prevent illness, then the patient will live longer and we will save money on the program. So it's very good. Physical therapy is covered under Part B. Durable medical equipment. If anybody says DME, that's what they're referring to. And this is a Part B service, so utilize it. Your primary care physician does need to sign off on it, saying that you need the equipment. But let's say you just have Part A and Part B. Well, Medicare will pay 80% of the Medicare approved amount, which is fancy jargon to say the DME provider cannot charge retail pricing. They have to charge Medicare pricing. And then they pay 80% of the Medicare pricing and you only pay 20%. Now, if you have a Medicare supplement, you pay probably nothing depending on the plan that you have, okay? Or very, very little. A lot of the Medicare Advantage plans, they still make you pay the 20%, but again, that can be pretty insignificant depending on the item that you're purchasing. So what are some examples? Well, wheelchairs are an example, a walker, CPAP machines, so stuff that usually stays around for a while. If it's disposable, it's usually not Medicare Part B or durable medical equipment. The only weird exception to that is diabetes test strips. They consider that to be DME, and they provide that under Part B. Outpatient surgery, okay. And chemodialysis and radiation is also Part B. And so I think a better term to describe medical insurance is outpatient care. So for the most part, this is stuff that is done and over within a day. All right. So remember, we had Part A was inpatient, Part B is outpatient. So tip number 2, there are many services that do not require you to pay an additional coinsurance or a deductible under Part B. So take advantage of it. Don't be afraid to use it. And these are all the services that do not require additional coinsurance. So even if you don't have a supplement, you could, if the doctor prescribes a colonoscopy or a vaccine or antibody test, diabetes screenings, any of these here, or this next list here, okay, you will not have to come out of pocket for any additional coinsurance. All right. The one at the very bottom is called the wellness visit. And I would like to talk about that a little bit. This is an opportunity for you to update your personalized health plan once per year. And this helps your doctor, assess you so that way we can prevent any disease or disability based on your current health and risk factors. You will complete a health risk assessment, which will help your provider update your prevention plan. And so a part of the health risk assessment now is the cognitive assessment. So if your doctor has done any type of funny memory tests, this is what they're searching for. They're trying to detect if there's any signs of dementia. And I'm really happy they're doing this because, as you probably know, once you kind of get too far along in the stages of dementia, it can be hard to do anything about it. So the earlier they can detect this, the better. Some people have told me my doctor has not been doing this. Well, you can try to remind them. It is kind of new, so but a lot of the doctors are now putting this in their health risk assessment. So if you just have parts A and B together and you don't have an Advantage plan, you have what's called Original Medicare. If you have a supplement, which we'll talk about, that's one of those plan letters like F or G or N, that is also a part of Original Medicare. And so these are the most common supplemental insurance plans. We have Plan F, G, and N. And this is what you call a Medicare supplement chart. Now, this kind of looks confusing, but this comes from the federal government. It says Medigap here in the left-hand corner. That's the same thing as a supplement, okay? And it used to be that Plan F was the most popular plan to buy. Why? Because all of these services here on the left-hand corner were covered 100% under Plan F, except for foreign travel. So the beauty of this plan, it was easy to sell for insurance agents and easy for clients to understand. All you would say is, hey, as long as you pay your premium, you will never receive a bill for Medicare covered services. That was pretty nice. However, it turns out that Plan F is no longer available to new Medicare beneficiaries. So if you have the plan now, you're more than welcome to keep it. I'm going to talk about why that might not be the best financial decision as things change, but nevertheless, you can keep it if you want. The next best plan is Plan G, which is just to the right of F. And the only difference between F and G is that G requires you to pay an annual deductible of $233. Okay, that's it. The other difference is the cost of the plan. We're starting to see that G is significantly less than F on a monthly basis. All the way to the right is Plan N, and the difference between G and N is that when you go to the doctor, you have to pay $20 and like a copay, and then $50 for emergency room visits. And then you also have to make sure that they accept Medicare pricing, because if they don't, then you have to pay the difference. Okay, we call that doctor excess charges. But I pulled the data from the Medicare website. It seemed like about 97% of doctors that accept Medicare also accept Medicare pricing. So it's kind of rare that that actually happens. So in general, what are supplements? Well, they help cover the Medicare deductibles and coinsurance, okay? It's important to know that Medicare does not cap that 20% coinsurance. So it can go, depending on your situation, this is an exaggeration, but if the bill was $1 million, then you'd pay 200,000. If the bill's 100,000, you pay 20,000. So that's one of the main reasons. There's other reasons as well, but that the supplemental insurance is very important. Okay. Another thing here is that it's important to know that Medicare supplements are not Medicare Advantage plans. So if somebody tries to sell you an Advantage plan and they tell you it's a supplement, that's incorrect, because Advantage plans are a completely different way to get your Medicare benefits, okay? And so here are some of the differences between a supplement and an Advantage plan. First of all, supplement benefits never change. You're guaranteed to keep that supplement as long as you pay your premium. So it doesn't matter how sick you get, doesn't matter how old you get, you are always guaranteed to have a Medicare supplement as long as you continue to pay the premium. With a supplement, you have the freedom to choose any doctor that accepts Medicare. So Advantage plans, they all have a network of doctors. Some people like that, other people want more flexibility. If you're somebody that values that flexibility and you want to go to the specialist that you want to see, whether it's here in California or it's all the way on the East Coast in New York, you can do that with a supplement. Okay, the key is they just must accept Medicare. So remember I said Supplement Plan F is no longer available as of 2020 to new Medicare beneficiaries. So my tip number 3 is that if you have Supplement Plan F, changing to Supplement Plan G might save you money. I say might because everyone's situation is different. It depends on when you enrolled, where you enrolled, and what insurance company you have. Okay, sometimes people come to me and say, hey, I want to try to save money by switching to Plan G. And I look at the rate that they're paying for Plan F, and it's still pretty competitive. Other times, we can save them quite a bit of money. Okay. And so the reason that this is happening is because, like I said, it's no longer available, Plan F. So as fewer people enter the plan and more people exit the plan, that pool of people is getting smaller and smaller and smaller. And the insurance company looks at that and goes, that's a very undiversified group of people. The people that remain in that group is shrinking, and they're getting more unhealthy as the years go on. And so when the insurance companies look at that, they go, that's a risky pool of people. We have no healthy people entering the plan to kind of offset the cost of the unhealthy people. So what do? They increase the rate on Plan F, okay? And so right here I say, even though Plan G has a deductible and Plan F has no deductible, the money you end up saving on the Plan G premiums can outweigh that tiny deductible, and overall in a year can save you more money. All right, but this is a case-by-case basis. It's not guaranteed. Like I said, there's a lot of factors, but we do have a lot of people switching from F to G. Okay. So moving on to tip number 4, when it comes to supplements, not Advantage plans, okay? Most people think they have to wait until the open enrollment period to change from one insurance company to another. That is simply not true. That is only true for Advantage plans, okay? Now, since we live in California, we have what's known as the California birthday rule. Why is this important? Well, I said you could change at any time. Well, I said you don't have to wait until the open enrollment period, and you could apply at any time, but they will ask you health questions. And so that can be, that you could be denied because if you answer negatively to any of their health questions. So if you apply 60 days before your birthday, you do not have to answer those health questions and you will be automatically approved. The only stipulations are that you have to be, 1, a California resident, 2, you have to have a Medicare supplement now, and 3, you have to changing from one supplement to another with equal or lesser benefits. Okay. So if you have any health issues going on and you want to try to change your supplement, I say do it 60 days before your birthday, or you can even do it 60 days after. If you are healthy and you don't have any major health issues going on, you can apply at any time. Just know that they're going to put you under medical underwriting, which is them asking you about 14 health-related questions, and they will look at your medications and your health history. Okay, so if you want to avoid that, I say just wait until 60 days before your birthday. All right, and again, feel free to stop me at any time. I'm going to move on to Part D, which is how a lot of people get their medications, D for drugs. And so Part D is usually for those that are on original Medicare, especially here in California. If you have an Advantage plan in California, you won't need a Part D plan. So Part D plans are standalone, which simply means they are not a part of your supplement or your Advantage plan. It's your own insurance card. It's your own insurance plan, separate from all of your other plans. Part D plans are administered by private insurance companies, not Medicare. And for 2022, there are only 25 drug plans available. Being a little sarcastic there, but last year we had 32 plans. This number changes every single year. And the cost of plans can greatly vary for the same exact medications, okay? And so, you know, some people, they get kind of complacent in their medication, in their drug plan. And let's say you were with ABC drug plan and they were charging you $1,000, but there might be an XYZ drug plan, a different insurance company, that's only charging you $500 for the same exact meds. Okay, so don't get complacent. That's tip number 5. Every October 15th to December 7th, you have the opportunity to shop your drug plan. Okay. And changing your drug plan can save you hundreds, if not, sometimes we've seen thousands of dollars per year. The time you can do that again is right there, October 15th to December 7th, Pearl Harbor Day. So as long as you get an application in by December 7th, you'll have a new plan by January 1st. And so there's 3 options that you can do this, how you can do this. One, you can go to the Medicare website. If you like to do things yourself, that's great. You can go to that link there and you can enter your medications, the quantity, frequency, and dosage, and you'll find which plan allows you to spend the least amount out of your pocket on an annual basis. The second option is you can call HiCap. They are hired by the state and it's a free service, and that's their phone number there. Okay. And the third option is you can use an independent insurance broker. And the reason you want to make sure that they're independent is because if they only work for one insurance company, that's the only plan they can sell you, and likely it's not going to be the best deal for you. So you want to make sure that they represent quite a few different plans, so that way they can shop the plan for you. So let's say you decide to do this yourself. Okay, what you want to look for is the lowest annual out-of-pocket cost. Okay, not the monthly premium, but what is the total cost, the cost of your premiums, your co-pays, and your deductibles. Okay, and so just don't be fooled by low premiums. Now, sometimes the lowest premium is the best plan for you, but oftentimes not. And so some people get excited and they look at it and they go, oh, this plan is only $10 a month, $20 a month, or whatever, but they end up paying hundreds of dollars at the pharmacy in co-insurance or co-pays. Okay, so those co-pays certainly add up and can end up not being in your favor. All right. So when we put this all together, if you have original Medicare, you would have A, B, you would probably have a Part D plan, and hopefully you have a Medicare supplement as well. The other option is Medicare Advantage, okay? And Medicare Advantage plans, I would say about 90+% of all the advertisements that everyone sees about Medicare have to do with Medicare Advantage, okay? And so we hear a lot about the positives. You get, they offer free dental, free rides to your doctor's appointments. Sometimes they, sometimes they offer, they'll pay your Part B premium, all of this stuff. They harp on those benefits. And today I'm going to kind of, I will talk about some of the benefits, but I'll also make you aware of some of the disadvantages of these Advantage plans. Okay, the first one is you have to subscribe to a network of doctors. So I told you with a supplement, there's no network. You can see anybody that accepts Medicare. If you value freedom and flexibility in your choice of a specialist, this would not be a great plan for you, okay, any of the Advantage plans, unless if your specialist happens to be in that network. But we never know, down the road, we might want to change the specialist, or we might develop an illness that requires a different type of specialist, okay? So again, if you value freedom and flexibility as far as choosing your doctors go, this may not be the best way to go. Now, a good thing is they usually include their prescription drug coverage, and they do so here in California. Now, that doesn't mean it's free. They have their own costs associated with their medications, but nevertheless, you will not have a separate plan. They kind of put it together. So that's kind of nice. They usually offer some type of limited dental and vision coverage. Okay. Now, I say limited because all of the plans I've seen, they only do like 2 cleanings per year for your teeth. You'll get an eye exam for your vision, and maybe they'll give you a pair of glasses. But as far as the dental goes, they're not going to do like a major, service like a root canal or a bridge. Okay, usually you have to pay out of pocket for that stuff. Typically on Advantage plans, you'll see a very low premium. Some of them in the Bay Area only cost $0 per month. However, they have a much higher out-of-pocket cost sharing. So remember I told you with like a supplement, like if you had Plan F, you pay nothing out of pocket. If you have Plan G, you only pay $233. These, they cap the co-insurance at around, on some of them, upwards of $7,000. Some are less, some, but they're typically no more than $7,000 for this year. So you have to be aware of that. You have to decide, okay, yes, it's only cost me $0 per month, but am I okay if something were to happen and I end up having to pay more out of pocket in my co-insurance once I use the service? So I'm sure you've all seen this commercial. When I do the seminars in person, I hear a big ol', right? We're sick of seeing these commercials. They're on 3 or 4 times a day, maybe more. So I have nothing against the man, but I want to point out his words carefully. It says, they explained I could get a plan that includes dental and prescription drug coverage, and we'll shine your shoes, wash your car, and give you a gym membership. Okay, they don't say quite that, but something along those lines. But what he doesn't say is, I signed up for this plan and it's amazing, right? And another thing is, this is not Medicare, okay? And people see the red, white, and blue, they see the American flag, it says Medicare, and so they kind of think, oh, they are hired by Medicare, and I should be getting all the benefits I deserve, and so they end up calling. And so I already mentioned some of the pitfalls of those plans. I'm going to talk about a little bit more. So my tip number 6, if you're deciding if you want to enroll, whether or not to enroll in an Advantage plan, you need to really consider the pros and cons. Don't fall susceptible to the free services or discounts, because those services or discounts probably do not outweigh some of the cons that might be necessary for your medical care. So another thing about Advantage plans is they usually require prior authorization to have your services covered. That's not true with the supplement. Again, you do not have the freedom to choose any provider that accepts Medicare, okay? Your physician or specialist can leave the network anytime. So if you're having an ongoing health issue and you develop a pretty good relationship with the specialist and they know your problem intimately and they decide, hey, this Advantage plan is no longer good for my business, they have the right to leave, and then you have to find a new specialist. Okay. Another big one about Advantage plans is that your benefits, including your drug coverage, can change and always do. It seems to be the case anyways every single year. Remember I told you with supplements, your benefits never change. Advantage plans, usually they do. And here's the big one that is not really advertised from these Advantage plan companies, is that let's say, for example, you had a supplement, you had supplement plan F, and you saw one of those commercials or you saw an ad somewhere else and you decided, I need to get all of the benefits that I deserved. I've worked hard in this country. I've paid all of my taxes, so I should be maximizing my benefits, right? Sounds reasonable. Well, let's say a couple years go on and you end up developing something that's kind of serious, like cancer or some type of specialty or some type of disease that requires special treatment. And you start to realize that this Medicare Advantage plan is hassling you as far as paying their bills on time, or maybe there's just too many hoops that you don't want to jump through, or maybe you can't see the specialist that you want to go see. And you go, I want my supplement back. So you try to return to original Medicare, which you can do, but you are not guaranteed to get your supplement back. Why? Because the insurance company will ask you health questions. And if you are sick, which is usually the reason why people want to change, is because they're having problems with their health plan and they need those services covered, you will likely be denied for your Advantage plan or for your supplement. So this is a plea to you. If you have a supplement, I would urge you to hang on to it. Okay. Now there are some laws that do protect people that change. If you try, you have what's known as a trial right. If it was the first time that you tried an Advantage plan and you decided within that year you don't like it, you have the right to get your old supplement back. Okay. And there are some other laws in place as well, but they're less common. Like one is if your Advantage plan, or if you move out of the area, then you have the right to get a supplement. Okay. So that's something, this is one of the big reasons I do these Medicare seminars, is this point right here, tip number 6, okay, because it's kind of a big deal. So the next time you can change your Advantage plan, if you have one now, is during the annual election period, and that is October 15th to December 7th. You can change from one Advantage plan to another, or you can apply for a supplement and return to original Medicare. Make sure you apply first before making any changes, because we want to make sure that you are approved, because remember, you're most likely going to have to go under medical underwriting. All right. Changes for Medicare in 2022. You may have noticed, if you look at your Social Security statement, that your Part B premium increased. Some people never look at that stuff and they just file it away or put it in the shredder. I tend to be that way. I don't like paperwork. But nevertheless, your premium went from $148.50 to $170.10. That is a 15% increase, and that is the largest increase we have ever seen. If you're a high income earner, then your Part B premium is even higher, and probably much higher. Okay. So why did it increase? Well, I thought maybe it had to do with inflation. Everything's going up, so maybe they were accommodating for that, but still that seemed to be unusually high. So what was the reason? Well, I will email this a packet to Anne, and if anybody wants it, they can print this off. It'll be in the packet, but it has to do with a medication called Aduhelm. And Aduhelm is a medication that was proposed to treat Alzheimer's. Seemed like it was going to be an effective medication. However, the cost of the medication, yes, that is the right look, only $56,000 per treatment.
Only.
Okay. Yeah, pocket change. It turns out Aduhelm lacks evidence that it's effective. Okay. Because it's not effective, the price of Aduhelm was cut in half. what a savings, only $28,200 now. But in my opinion, it's not worth 1 penny if the drug is not effective. So it seems to be the case that doctors are not really administering this medication. They might be doing it under some trials, but that's about it. And yes, I will send that to Annie as well. And so what's going on here? Well, CMS just released a statement saying, yes, of course we want to treat Alzheimer's. However, there's not currently enough evidence of demonstrating improved health outcomes to say that it, meaning Aduhelm, is reasonable and necessary for people with Medicare. So it begs the question, why are seniors having to pay more for their Part B on the basis of a medication that does not work? As of right now, I do not have any fantastic news. My hope, and there's only been rumors at this point, that they will actually decrease the premium. The latest I heard that is that if they do decrease the premium, they will do it next year, starting in January. But nothing has been promised yet. My hope is that they do the right thing. I think they should lower the premium. It may only be by $10, who knows, but hopefully we do see a decrease there. The second change or ongoing change that's going on right now has to do with those Medicare Advantage plans we talked about. And you can see the headline here. It says Medicare Advantage plans often deny needed care, federal report finds. And many of the agents, such as myself, we have known this because, like when I first started, I sold a few of these plans. They seemed to be pretty good, but then especially people with kind of critical illnesses, they were starting to have major issues with trying to get these Advantage plans to pay their bills. And then we would have to file an appeals process, and it was a big old headache on top of already the client being sick. So thankfully, the Inspector General has gotten involved, and they are investigating these plans. So I think that these plans could be good, but we have to make sure that the people, selling the plans and the people that are actually, that the owners of the companies and all of that are doing the right thing. And so instead of just trying to nickel and dime everyone, we want to make sure that the beneficiaries are getting coverage when they need it. Okay. So this is also included in the packet, which I will email. The last bit here talks about how to avoid scams and shady business practices. I would say there's a lot of scams out there, and then there are others that are maybe not technically breaking the law, but they're kind of towing that line. And so I just want to make you aware of some of these tactics. The first one is, if anyone cold calls you and they say that they are from Medicare or Social Security, this is a scam. Okay. Medicare, Social Security, they do not call you unless if you have some type of ongoing business. But if somebody calls you out of the blue and they say they're from Medicare or Social Security, it's not them. Okay. And so another thing is, Social Security, IRS, Medicare, they do not threaten you. All right. And like my mother, she worked for a bank for many years, and she told me that at least once a week, this was not an exaggeration, that an elderly person would be coming in because they wanted to wire money to somebody in a foreign country because they were nervous because they were told that their grandchild was being held hostage in another country. Okay, that's just a scare tactic. If you do feel uncomfortable in that situation, call them. Call your grandchild or whatever, just to say, hey, are you okay? You want to go have lunch or what have you. So just to make sure that they are actually okay. But all of those are scams. Okay. The second one, this one's a little bit trickier, but if anyone cold calls your cell phone using an automatic dialer regarding your Medicare benefits, they are breaking the law. And for that matter, if they're calling you about any solicitations, they are breaking the law. And how do we know if it's an automatic dialer? Well, have you ever gotten a sales call? You pick up the phone and you say hello, and there's a 3-second delay, and then you say hello again, and then finally somebody says, hi, I'm such and such, and blah, blah, blah. That is an automatic dialer. Why? Because what those automatic dialers are doing is they are calling 5 to 10 phone numbers at once, and they're just, once they connect to somebody that answers the phone, there's a delay for once you answer. Okay, and so my tip number 7 is just please, I would not agree to change your Medicare plan over the phone unless if you know who the person you're talking to. So I do a lot of business over the phone, but that's usually because they already know who I am, right? They've called me. But if you don't know who they are and they've called you out of the blue, I would disregard them. My tip number 8, some people have told me this works, some people have told me it hasn't worked for them. I say it's at least worth trying. Put your phone number on the do not call list. You can do so by calling this number here, or you can go to the website. If your phone number's changed, you'll need to do it again. And on their website, they say you only need to do it once. And so this will not only limit the amount of Medicare phone calls you'll receive, but also any solicitations whatsoever. So, and sometimes people just have a bad number, you know, and sometimes you might end up having to change your phone number, but hopefully you can do this and this should help. It takes about 30 days to take effect. Tip number 9, now if you place your information in on an ad, like a Facebook ad, we see a lot of that now, any type of social media, all bets are off. They can call you as much as they want, okay? And I did this just to see what Medicare beneficiaries go through. There's an ad for Medicare benefits, and I put my phone number in at 9 o'clock at night. And at 6:05 a.m. the next morning, I get my very first phone call. I said, hello. I said, hi, Mr. Olson, we're here to talk to you about your Medicare benefits. And I said to them, it's 6:05 in the morning. Why would you call anybody? Or I said, it's 6:05 in the morning. And then they said, yeah, it's 6:05. Okay. And I said, why would you call anybody this early in the morning? And then so he hangs up the phone on me. 6:35 rolls around, I get my second phone call. 7 o'clock rolls around, third phone call. Every half hour, and this is no exaggeration, for the next 3 weeks, I continued to get phone calls. It ended up and it didn't matter how many times I asked them to take me off their list. I ended up having to get in touch with their supervisor to have them remove me, okay? So, we skipped. So the thing is here, they can be pretty relentless. And so I do not recommend putting your phone number on one of those ads. Okay, so I'm going to do a quick review, and then if you have any questions, feel free to let me know. So remember, part A is your hospital insurance or inpatient care, okay? And you have the right to what is known as a fast appeal if you think you are being discharged too soon. Part B is medical insurance, or I prefer the term outpatient care. Just remember to use your annual wellness visit. It's once per year, and it doesn't cost you anything to do so.
I have a question.
Yes.
I understand that for that annual wellness visit, if anything is discussed that's not on their wellness list as things to be covered, then you're charged for the visit because it's another subject, another illness.
Yeah, you are correct about that. So
it seems to me it's a hoax. How can you go and have a physical or a wellness cover your body and not talk about what's going on and be caught in that trap?
Yeah, so if they do a full-on physical, they're allowed to charge for that. Now, this is what I would say to your doctor. I would say, if you need to go beyond the scope of what is in the annual wellness visit, you need to tell me in clear terms before we move forward. Okay, and they need to justify to you why it's necessary for them to do that. Because there's plenty of things in the annual wellness visit that are necessary, but sometimes as the discussion continues, they may realize we need to do a certain lab or test that will not be 100% covered. So that's a very great point. And I think, but I think I would be very forward with my doctor and say, hey, if you're going to do anything outside of the scope of an annual wellness visit, then you need to let me know before we move forward.
I think the problem is I don't know what that scope is and I bring something up.
Mm, yeah.
I've
Well,
cooked my own goose.
yeah, I see what you're saying. Well, what I can do is, I believe the Medicare handbook has those things listed in there. And what I can do is send that as part of the packet. So hopefully that'll help you a little bit better. But they should know, and you do rely on them being honest with you. So that's what you would have to do in that case. But
If I
um,
don't do it then, it means another visit. So
yeah,
it's
yeah,
probably 6 of 1, but I just think it's interesting.
yeah, yeah. That's a fair point. Okay, with Part C Medicare Advantage, there might be reasons that you like these plans that are for you, but in my opinion, please, I just would not choose them based on the free and gimmicky discounts. Okay, they can be a little restrictive, and if that doesn't work for the type of care that you need or that you think you might need, um, it could not be an advantage to you. Okay. Part D drug plans and your Advantage plan for that matter, have your plan reviewed every October 15th through December 7th. Okay. That can save you quite a bit of money. And if you haven't reviewed your plan in the last 5 or 10 years, you probably have left money on the table. But I say, let's stop the bleeding now and let's fix it this year. Make sure that you're on the best plan. The other thing is your medications change too. So, you know, it may have been the right plan for you for a few years, but if your medications have changed, that plan may not cover that medication as great as another plan. So it's just good to check. Part B decrease, still waiting to see if CMS will actually decrease the Part B premium. If they will, they said it would be next year. Okay. The last part here actually is if you have a Medicare supplement plan F, consider switching to plan G, as we've seen the price for F has rapidly increased for a lot of folks. All right. Any other questions? You can let me know. And for those of you that are watching the recording, you can always call my office or you can go to the website here.